Psychotherapy, 30 minutes with patient. When performed with an E/M service. Psychotherapy, 45 minutes with patient. When performed with an E/M service. Psychotherapy, 60 minutes with patient. When performed with an E/M service. Psychotherapy is a variety of treatment techniques in which a physician or other qualified healthcare provider helps a patient with a mental illness or behavioral disturbance identify and alleviate any emotional disruptions, maladaptive behavioral patterns, and contributing/exacerbating factors. This treatment also involves encouraging personality growth and development through coping techniques and problem-solving skills. Report 90,832 for 1/2 hour of face-to-face time spent with the patient without an additional evaluation and management, E/M, service. Report 90,833 if a separate E/M service is performed during the same encounter as the 30 minutes of psychotherapy. Psychotherapy for crisis, first 60 minutes. Each additional 30 minutes. Report these codes when the psychotherapy is for a patient with a life-threatening or highly complex psychiatric crisis. These codes include history, mental status examination, mobilization of resources, and implementation treatment. Psychoanalysis. The therapist performs psychoanalysis by utilizing methods of intense observation and analytical skills to investigate the patient's past experiences, unconscious motivations, and internal conflicts, as well as contributing medical conditions, to discover how these pilot the patient's current behavior and emotions. The psychiatrist seeks to produce change in maladapted behavior. Psychoanalysis includes reviewing medical notes and making clinical setting arrangements, assisting the patient in further self-awareness. Working through barriers, understanding self-observations, and modifying mental behavior and status while continuing to elicit more information and personal exploration. This code also includes follow-up work of documentation, content review, and peer consultation. Family psychotherapy, without the patient present, 50 minutes. The therapist provides 50 minutes of family psychotherapy in a setting where the care provider meets with the patient's family without the patient present. The family is part of the patient evaluation and treatment process. Family dynamics as they relate to the patient's mental status and behavior are a main focus of the sessions. Attention is also given to the impact the patient's condition has on the family, with therapy aimed at improving the interaction between the patient and family members. Family psychotherapy, conjoint psychotherapy, with patient present, 50 minutes. Reviewing records, communicating with other providers, observing and interpreting patterns of behavior and communication between the patient and family members, and decision-making regarding treatment, including medication management or any physical exam related to the medication, is included. Multiple family group psychotherapy. Multiple family group psychotherapy provided to a patient and his/her family, as well as other patients and families, all together. This is usually done in cases involving similar issues and often in settings of group homes, drug treatment facilities, or hospital rehabilitation centers. The session may focus on the issues of the patient's hospitalization or substance abuse problems. This code is reported once for each family group present. Group psychotherapy, other than of a multiple family group. The psychiatric treatment provider conducts psychotherapy for a group of several patients in one session. Group dynamics are explored. Emotional and rational cognitive interactions between individual persons in the group are facilitated and observed. Personal dynamics of any individual patient may be discussed within the group setting. Processes that help patients move toward emotional healing and modification of thought and behavior are used. Such as facilitating improved interpersonal exchanges, group support, and reminiscing. The group may be composed of patients with separate and distinct maladaptive disorders or persons sharing some facet of a disorder. This code should be used for group psychotherapy with other patients, and not members of the patient's families. Pharmacologic management, including prescription and review of medication, when performed with psychotherapy services. The patient's medications are managed during a psychiatric service, including the patient's current use of medicines, a medical review of the benefits and treatment progression, management of side effects, and review or change of prescription. This is a pharmacologically related service and is reported in addition to non-crisis related psychotherapy when there is no other evaluation and management service performed during the encounter. Electroconvulsive therapy includes necessary monitoring. The treating clinician initiates a seizure using electroconvulsive therapy, ECT, most often to combat chronic or profound depression, especially psychotic or intractable manic forms, and used for people who cannot take antidepressants. The clinician anesthetizes the patient with a barbiturate and a muscle relaxant. Electrodes are placed on the patient's temples and/or forehead, and a measured electrical dose is applied for about a second to commence the seizure, typically lasting 30 seconds to a minute. EEG and EKG monitors follow the seizure activity and heart rhythm while the patient sleeps through the therapy. The patient awakens a few minutes later. Hypnotherapy. Hypnosis is used as a modality for psychotherapy. The therapist induces an altered state of consciousness, or focused attention, in the patient. While patients are in this relaxed state of heightened awareness and suggestibility, they can experience changes in the way they feel, think, and behave in response to suggestions directed to them by the hypnotherapist. This modality for psychiatric services helps the therapist to achieve an alteration in the patient's thought and behavior patterns. Environmental intervention for medical management purposes on a psychiatric patient's behalf with agencies, employers, or institutions. The clinician uses this code to report work done with agencies, employers, or institutions on a psychiatric patient's behalf in order to achieve environmental changes and interventions for managing the patient's medical condition. Psychiatric evaluation of hospital records, other psychiatric reports, psychometric and/or projective tests, and other accumulated data for medical diagnostic purposes. The clinician reviews and evaluates the patient's hospital records, other psychiatric reports such as psychometric and projective tests, and other pertinent data for the purpose of gaining a medical diagnosis and insight into the patient's present condition. Interpretation or explanation of results of psychiatric, other medical examinations and procedures, or other accumulated data to family or other responsible persons, or advising them how to assist patient. The clinician interprets the results of a patient's psychiatric and medical examinations and procedures, as well as any other pertinent recorded data, and spends time explaining the patient's condition to family members and other responsible parties involved with the patient's care and well-being. Advice is also given as to how family members can best assist the patient. Preparation of report of patient's psychiatric status, history, treatment, or progress, other than for legal or consultative purposes, for other individuals, agencies, or insurance carriers. The clinician prepares a report on a patient's mental condition, current psychiatric status, history, treatment regimen, and progress for other providers, agencies, or insurance carriers involved with the patient's care, except for legal or consultative purposes.